The Gauteng Health Department has been leading the headlines today. The Hawks conducted search and seizure operations in areas such as Bedfordview, Germiston, as well as Edenvale. That's in connection with allegations of massive corruption at the Tembisa Hospital, especially during the time of the COVID-19 pandemic. Now, at the same time, the DA's Jack Bloom has issued a statement saying that the department has irregularly spent 700 million rand on a security contract for the province's hospitals. Let's talk about this with Nomantu, Nkomo-Ralehoko, the Gauteng Health MEC. A very good evening to you, MEC. Thank you for your time. First things first, your reaction to the raids today.
I
was asking you about the raids today on people who are allegedly involved in corruption in the health department and at the Tembisa Hospital specifically.
I don't have the rates with me. The person that can give you the rates is the acting HOT that I can ask you to come and talk to you if you need those numbers.
No,
but I wanted to hear from you. Hello?
I was asking, ma'am, how you would respond to the news today that law enforcement has carried out
the
raids. Yes, the raids, search and seizure, yes.
Oh, the Hawks that have raided our premises, okay. I think we agreed that SIU is having the report. Definitely, if SIU is having that report of the investigation, the Hawks can come in. And the Hawks have done the raids in some of the people that were involved in the area. So I think that's where I can leave it because it's their responsibility. I have not received any report so far. But we welcome anything that they are doing because it's in their pairing.
A report by News 24 today says among the properties raided is that of an ANC Ekurhuleni official, the ANC, the party of government in Gauteng. How do you respond to that aspect of what's happened today?
I know that because I've heard that his house was raided today. So I've not heard anything from the Hawks, and I wouldn't want to do any follow-up until I get a report from the acting HOT of what was happening. Yeah.
But it would be shameful, would it not? It would be shameful for the government that you're part of if your political organization had people involved in corruption, basically stealing from the public, allegedly, during a time of crisis, as was the COVID-19 pandemic.
Until I get a report, my brother, I will be able then to say any words that will be like shameful and other things. But so far, let me wait for the report.
I said if true, it would be.
If it's true.
Yeah, if true, that's what I said.
Definitely it's obvious because I'm a leader in that organization. I will not be comfortable with that because always you want people that you know, that you work with them must not be part of things like those.
Let's move on to the issue of these this security contract, 700 million rand, awarded irregularly, rolled over irregularly. I know you've also taken issue with it, as I understand it, even in a response to the DA. But how was it awarded in such a way to begin with, and who is facing consequences for that action?
Then those contracts, some of them, they were done by the hospital. They were split billing, which we have picked it up when the Gauteng Audit Service, when they were involved, they picked it up that. So that's why we are waiting for the SIU now to go deeper into the investigations, and Premier have asked the President to sign the proclamation so that we can be confident to speak out of the report that will come from the SIU on those investigations and even talk about it. So I would be uncomfortable to speak about it now because I don't want to jeopardize that process that the SIU is taking.
But there's clearly a problem, is there not, in the health department, because every few months there's an issue with a contract that is flagged, and more of these agreements are being increasingly investigated by the likes of the SIU. What has gone wrong in the department?
I wouldn't say that there is a problem, but what I can tell you is that we have our own internal and risk management unit that is conducting and determining the test to confirm if there are irregularities in any contract. And I'm sure even in the department you will be happy now that we are able to identify where we have a problem and there is a contract that is not right. We have tightened our controls, which it was a problem, which I agree with you. We didn't have tighter controls. Now we have tighter controls. And I think everybody in South Africa, the South Africans will appreciate that every tender now that we are having, there's some scrutiny that must be done. Hence, even the property auditors picked up that there are some of the tenders that are wrong. We have to cancel them.
Who is now responsible for security in place of where the people were deployed as per this contract that was awarded?
I will not know that because I'm not responsible for the area of tenders, but the acting HOD and the acting CFO can tell you who is responsible and how the process they've followed for any person that is involved in that. Yeah.
There was supposed to be, though, a process to re-advertise the tender.
Mm-hmm.
Has that happened? Has it been concluded?
Yes, that process is beginning of re-advertising the tender, and it's at the final stage as we speak.
When will it be concluded?
It will definitely be concluded mid-April. That's what the team briefed me when I wanted a report from them.
So at the affected stations then, I know you said the HOD and another official will be able to give us more detail, but have you guys not had conversations about who now steps in? Do the workers from the irregular contract remain in post until you finalized re-advertising, or have you brought in different people?
Yes, they are still there in the post now as we speak, but once we finalize, we're going to take them out.
But
because when you have to send them.
But you're going to pay.
Month. Yeah, it's month-to-month contract. That's why we have to pay them.
59 million rand. Is that how much you're paying every month?
We're paying that, but we have 37 hospitals, including our clinics. So it's not only for one contractor that we're paying. So it's 37 hospitals. We have academic hospitals, tertiary hospitals, regional hospitals, all our clinics in the province. They are part of that. District offices, including our office, that is at 45 Commissioner Street. So hence the amount is at that level.
But is it right, though, that a service provider or service providers who benefit from agreements awarded irregularly continue to benefit even while a process is underway to basically get their replacement? So you're basically not being punished.
We continue to get the services from them, and we must pay that service that they are rendering.
All right, Gauteng Health MEC Nomantu, Nkomo-Ralehoko, thank you for your time, ma'am.